Well, I like to say that most people get into healthcare because fundamentally they want to help people. And it was the same for me. So I got into occupational therapy and rehab because I landed on a bottle when I was fishing out of the river and cut up some tendons in my hand, and ended up being in an outpatient occupational therapy rehab clinic for the balance of the summer before my senior year. And I was there 2 or 3 times a week. I was in and out of splints, doing exercises, getting all kinds of treatment done. And one of the things that really struck me was my therapist. Not only did she give me the exercises, did she tell me what recommendations I had to do, but she was very involved in what was important to me and what were my goals for treatment. One of them being I was a high school senior, so I wanted to get back to playing guitar, and she had me bring the guitar into the clinic. She had me work on specific exercises for getting back to playing the guitar, and that experience stuck with me into college and into when I ultimately decided to pick a career, what I wanted to do when I grow up. I wanted to do that, and that was only possible because my therapist, when I was in a clinic as a patient, was not just somebody running through items on a checklist or running through some protocol that was out of a textbook or something like that. But she took the time to know me as a person, to understand what made me tick, so to speak, and then built my treatment plan around those things that were important to me. And when I started my career as a clinician, that's what I wanted to do. So it's something from the very beginning of my clinical experience, in my education, and in my experience in healthcare, has always been very important to me. The idea that as clinicians, as healthcare providers, our mission and our primary calling is really to understand the individual needs and the individual factors, if you would, of each patient that walks into our clinic, and then to help them chart their own unique path to recovery.